Hello, happy Friday. Working in the home office today, and today now is the day that I am going to answer all the questions that came in over the week. I have more time to do the Q's and A's on Friday because it's my admin day here at home. I'm not in clinic, and I didn't expect the amount of questions that actually came through. So look, let's just dive right in. So the level of pain that's felt during an eyebrow tattoo, this is a question that we've addressed before. And with us here in Browteak, we have 4 registered nurses, and our pain relief is absolutely second to none. You have a topical anaesthetic before we do the draw. We have a secondary anaesthetic after we do some of the outline strokes, which is a liquid, and we have a tertiary anaesthetic, which is a gel, and most of our clients actually fall asleep during the treatment. So there are a couple of factors to consider, and everybody's pain tolerance is very different. It very depends on where you are in your menstrual cycle. Some people might find it uncomfortable, other people find it as a minor discomfort. But we pride ourselves on the fact that our clients are not rushed and that the anaesthetics are given plenty of time to work. The anaesthetics that we use are medical grade, so therefore it's very important that you are aware that it's not the anaesthetic that you would get if you were going to somebody who's not a medical personnel. Very depends on the sensitivity that you have around your eyebrow area. Sometimes the orbital bone, it's very thin skin, so it can be very sensitive. Putting in the pigment, we barely scratch underneath the surface, so the most that any of our clients feel at the outset would be a 2 out of 10. So I hope that would be the case for you too. How do I choose the right technician? So I'm not sure if that is the eyebrow technician within Browteak Ireland or whether it is the right eyebrow technician for you in general. As you know, it's an unregulated industry, but let's just break it down for the technicians, the eyebrow technician nurses that are within Browteak Ireland. Myself, I'm the owner of the business, and I do microblading and blade and shade technique. Nurse Aisling does micropigmentation in hair stroke and powder brow. Nurse Debbie does micropigmentation. She's in Dublin, and she does powder brow. And Nurse Lorraine in Limerick, she does hair stroke technique by machine, micropigmentation and powder brow as well. Added to this, Nurse Aisling also does a misty brow, which is a very, very gentle and light fill. All of us can do that. So if you're unsure as to who to book, it depending on your location. So if you're in Dublin and Naas, Nurse Debbie will be able to take care of you. If you're in Limerick, Nurse Lorraine will be able to take care of you. The west of Ireland, Galway, Tipperary and so on. And myself and Aisling in Clonakilty will be able to take care of you in Clonakilty, Cork, Munster, Kerry and so on. So all of us do eyebrow consultations, and we will be able to help you to decide what technique is best for you. Eyebrow microblading is ideal for people who have some eyebrow hair, and we can actually create that strokes in between the eyebrows. Eyebrow micropigmentation or blade and shade technique is ideal for somebody who's got no eyebrow hair. All of us will be able to help you either way. It's still a tattoo, and we want to be able to deliver the best possible way to you. Loads of questions about the skin boosters. So how long do the results of the skin boosters last? So I have trained with the gold standard, Belotero by Merz, Belotero Revive. And once we get you to where you need to be, depending on your age, usually you need to have a mil, and then 2 weeks or 3 weeks later, you could have that repeated if your skin needs it. We need to get you to the area whereby you get that lovely glow. And then once you have the glow, you can keep coming every 2 weeks until you get the glow. And then after that, then it is 6 to 9 months. So there's other cheaper hyaluronic acid injectables on the market. And obviously they're cheaper, but they only last 30 days. And Merz boasts 6 to 9 months. So I haven't injected my face since February last, so it's really keeping its glow. Okay, so a lot of people ask me to know what my skincare routine is for my 60-year-old skin, and I suppose look, I've no problem telling you what my skincare routine is. Sharna has taken 2 years to get my skin around to where we are right now, and I embarked on a skincare program at the age of 58, and it's taken me until now to actually get rid of those awful brown pigmented spots that I burnt the living life out of my skin when I was in my 20s in Australia. The more burnt we were, the more we loved it. Anyway, Sharna has recently added vitamin C by Reform, so hyaluronic acid, vitamin C and E. After I do my double cleanse in the morning time, I add this first, and then I go on to the Ultimate Boost, which is here, and then my SPF. So that's after my double. Hormonal fluctuations. So I'm not a doctor and I'm not a dermatologist, but what I learned when I did the aesthetic courses, and I've done a couple of them now, is that with the hormonal fluctuations in our body, particularly the likes of menopause, so I'm 60 now, there's an estrogen decline. Well, it's probably gone in me now, and what that does is that when you have an estrogen decline, our skin gets thinner. Our muscle and fat pads in our face, which keeps us youthful. You see those lovely 20-year-olds going around, their gorgeous plump little faces. That's gone. It's deteriorated, and bone density, as you know, bone is in our skull, so that has also deteriorated. So the loose skin has got nothing to hold on to. What does it do? Only just fall down and gives us these crepey things here. Recently, I've started to inject hyaluronic acid into my neck and my décolletage. Very crepey turkey neck. So in menopause, collagen and the elasticity, like the estrogen, which is now depleted, helps to stimulate the collagen and the elastin production, and these contribute to the skin's firmness and elasticity, and as the estrogen levels drop, the skin becomes more prone to sagging and wrinkles. Hello, it's going on here. So I inject little beads of it along here to just give this area moisture from within, and to help reduce that dryness, crepiness, turkiness that's going on. Now this area here, extremely badly treated in my 60 years, particularly in my 20s. I was 4 years in Australia. The more burnt we were, the more we loved it. And now I'm suffering. So it's got a lot of pigmentation going on. Now I did inject this area here. It would take about 2 to 3 mils, depending on the size of your chest. Just little droplets all the way along here. I could go on and on between skin dryness and hyperpigmentation, which happens with hormonal fluctuations anyway, such as those in pregnancy and birth control pills, and the overproduction of melanin and leading to hyperpigmentation or age spots. These are all age spots. They're disgusting, and I may have to go down the road of laser, but at the moment I'm trying to give them that illusion of a lovely youthful glow by getting rid of the crepiness. The age spots hopefully will deteriorate in time. Sometimes I bring the tretinoin down here as well, and the Vit C, and that helps to sort of reduce them. Anyway, I'm only going by what Sharna tells me, and as I say, what suits me does not necessarily suit you. So go to Sharna for a consultation, and she'll let you know whether you need, what facials you need, what products you need, and whether you need to come to me or not.